You have probably heard the question, or even asked it yourself, why would a nurse seek, or an employer encourage, national certification in a clinical specialty? The National Certification Corporation, often referred to as NCC, provides the following presentation in response to that pertinent question. The National Certification Corporation, a voluntary, nonprofit, nationally recognized certification organization, has provided certification and subspecialty credentialing examinations for over 35 years. Over 120,000 individuals have attained their NCC credential. An NCC credential directly supports quality patient care, consumer satisfaction, patient safety, and professional pride. An NCC credential supports quality patient care as patients and their families expect the best from your organization. Having NCC certified staff on your perinatal units meets that expectation, with validation of knowledge, expertise, and commitment. Organizations that attain or maintain the American Nurses Credentialing Center Magnet designation achieve national recognition as a healthcare provider, demonstrating quality patient care and nursing excellence, in addition to innovations in professional nursing practice. According to February 2013 statistics, ANCC reports that a characteristic of the average magnet organization is that 58.97% of their RN decision makers hold a certification from a nationally recognized organization. Among average pediatric magnet facilities, the percentage of RN decision makers holding national certification is 71.8%. NCC's new Professional Development Maintenance Program has been applauded by national advocates for consumer healthcare interests as an appropriate step in demonstrating accountability and continuing competency throughout a professional career. The model addresses maintenance of an NCC credential based on validation of knowledge competencies aligned with the individual's certification specialty and directs their maintenance needs based on an individualized learning plan. This certification maintenance mechanism provides independent, third-party validation of continuing competency for patients, families, employers, and regulatory agencies. An NCC credential supports consumer satisfaction based on recent and ongoing national broadcasts developed to increase public awareness about the benefits of having a certified nurse providing their care. Consumers are starting to ask for more information and to realize that nurses, just as the physicians who provide their care, can be nationally certified in their specialty. Based on this increase in public education, expect patients and families to ask if your organization has certified nurses. Employers need to recognize this increase in consumer interest and the potential it creates for direct inquiries about the availability of certified nurses to provide care within their organization. An NCC credential as an indicator of patient safety. From the perspective of a perinatal risk reduction strategy, the NCC Electronic Fetal Monitoring, EFM, subspecialty examination has been used nationally as a critical component of risk reduction strategies within labor and delivery. Use of the EFM examination in these risk reduction strategies supports a focus on the standardized use of the National Institute of Child Health and Human Development, or NICHD terminology, and promotes improved teamwork and communication in labor and delivery areas. NCC's EFM examination provides a unique, multidisciplinary eligibility, which promotes an organization's ability to validate perinatal risk reduction through improved interdisciplinary communication among team members and standardization of the common terminology used to communicate critical changes in the perinatal setting. It is not uncommon to find that individual organizations, as well as perinatal healthcare networks, consider credentialing of their staff using NCC's Electronic Fetal Monitoring subspecialty examination to be a crucial component of their overall perinatal patient safety initiatives aimed at preventing adverse outcomes. A number of recent articles in the professional literature, such as the one cited here, have highlighted the use of NCC's EFM examination within perinatal initiatives, which ultimately resulted in documented reductions in adverse patient outcomes as well as in the cost of liability claims. Over a 5-year period, 16 perinatal units using NCC's EFM subspecialty examination as an element of their comprehensive approach to improve perinatal patient safety had outcome data which demonstrated marked reductions in their birth trauma rates, number of obstetrical occurrences, and average cost per obstetric claim. Additionally, the number of new claims in this high-risk specialty area decreased by 48%. An NCC credential supports professional pride. The following are actual comments from NCC certified professionals speaking out about their nationally recognized NCC credential. In the words of an RN certified in inpatient obstetric nursing, "As a professional, I really believe that we have an obligation to ourselves and to our patients to demonstrate national competency in our area of specialization." As stated by an RN certified in neonatal intensive care nursing, being NCC certified was a professional and personal goal of mine. I believe it validates my skills and knowledge while allowing me to give improved care to my tiny patients. Expressed by a board-certified neonatal nurse practitioner. My NCC certification allows me to be seen as the go-to person on my unit. By being certified, I am assuring people that I have an ongoing education and keep up to date on the current topics of my field. As proclaimed by an individual with dual certification as an inpatient obstetric nurse and as a women's healthcare nurse practitioner, I am very proud to be certified by the National Certification Corporation in 2 clinical areas: to assure the families and the women that I provide care for that I am committed to the highest quality of service and practice, that I am practicing at the highest standard of evidence-based practice. As expressed by a physician who is a fellow in the American College of Obstetrics and Gynecology and a board-certified maternal-fetal medicine specialist holding an NCC credential in electronic fetal monitoring. With my electronic fetal monitoring credential, it makes communication among the team members so much clearer, since we are all held to the same standards, both nurses and physicians. We know that we are significantly decreasing the risk of miscommunication. I am so proud to be a member of the L&D team. We're all finally speaking the same language.